What is Down syndrome? Down syndrome is a genetic condition that causes delays in physical and intellectual development. It occurs in every 1 in 691 live births. Individuals with Down syndrome have 47 chromosomes instead of the usual 46. Down syndrome is the most frequently occurring chromosomal defect, and it is not related to religion, race, nationality, or socioeconomic status. Down syndrome is usually identified at birth or shortly after. Initially, the diagnosis is based on the physical characteristics of babies with Down syndrome. Physical characteristics include low muscle tone, a single crease along the palm of the hand, a slight flattened facial profile, and upward slanted eyes. The diagnosis must be confirmed by a chromosome study. A karyotype, a chromosomal study, provides a visual display of the chromosomes grouped by their size, number, and shape. Chromosomes may be studied by examining blood or tissue cells.
More than 60% of children with Down syndrome have vision problems. This includes crossed eyes, near farsightedness, and cataracts. Glasses, surgery, or other treatments can usually improve vision. A child with Down syndrome should be examined by an eye doctor within the first 6 months of life and have regular vision exams. About 75% of children with Down syndrome have hearing loss. Hearing loss may be due to fluid in the middle ear and/or defects in the middle and inner ear. Babies with Down syndrome should be screened for hearing loss at birth and again within the first few months of life. They should also have regular hearing exams so any problems can be treated before they hinder the development of language and other skills. Children with Down syndrome tend to have many colds and ear infections, as well as bronchitis and pneumonia. They should receive all the standard childhood immunizations, which help prevent some of these infections. About 1% of babies who are born with Down syndrome are born with a thyroid hormone deficiency that can affect brain development and growth. This deficiency can be detected through routine newborn screening tests and treated with oral doses of the thyroid hormone. Children with Down syndrome are also at increased risk of developing thyroid problems and should be tested yearly. Fewer than 1 in 100 children with Down syndrome develop leukemia, and this can sometimes be successfully treated with chemotherapy. Individuals with Down syndrome are more likely than unaffected individuals to develop Alzheimer's. Alzheimer's is characterized by progressive memory loss, personality changes, and other problems. Adults with Down syndrome tend to develop Alzheimer's disease at an earlier age than unaffected individuals. Studies suggest that about 25% of adults with Down syndrome over the age of 35 have symptoms of Alzheimer's disease. Babies and adults with Down syndrome can have physical problems as well as intellectual disabilities. Every baby born with Down syndrome is different. In addition to the physical signs, some might have major birth defects or other medical problems. Still, some physical problems that are associated with Down syndrome include a birth defect of the heart, stomach problems such as the blocked small intestine, problems with memory, concentration, and judgment, often called dementia, hearing problems, eye problems such as cataracts or trouble seeing items that are close by. However, many people with Down syndrome live happy, productive lives well into adulthood.
People with Down syndrome have an increased risk for some health conditions.
Congenital heart disease. The incidence of congenital heart disease in newborn babies with Down syndrome is up to 50%. Heart defects are very common and affect a significant amount of Down syndrome patients. Cancer. Greatly reduced incidences of many common malignancies except leukemia and testicular cancer. Leukemia is 10 to 50 times more common in children with Down syndrome. Gastrointestinal disease. Down syndrome increases the risk of Hirschsprung's disease, in which the nerve cell that controls the function of parts of the colon are not present. This results in severe constipation. Infertility. Males with Down syndrome usually cannot father children, while females demonstrate significantly lower rates of conception relative to unaffected individuals. Women with Down syndrome are less fertile. There have been only 3 recorded instances of males with Down syndrome fathering children.
Individuals with Down syndrome are at a higher risk for many medical conditions. The medical consequences of having an extra 21st chromosome are highly variable. They can affect the function of any organ system or body process, and can even contribute to a lower life expectancy. Most individuals with Down syndrome have an intellectual disability, and it can range from mildly retarded to severely retarded. Individuals with Down syndrome may also have a speech delay, and their fine motor skills often lag behind their gross motor skills. Here's a picture of the chromosomes of a person suffering from Down syndrome. You can see they have an extra 21st chromosome, and this is why a person has Down syndrome. There are a lot of symptoms of Down syndrome, but here's some of them. Stunted growth, mental retardation, smaller genitalia, lower set or rounded ears, a flattened nose or smaller teeth, a smaller neck, and even smaller hands.
There are multiple prenatal tests you can do to scan for Down syndrome. Both ACOG and NICE guidelines recommend that screening for Down syndrome be offered to all pregnant women regardless of age. A number of tests can be used to screen for Down syndrome with varying levels of accuracy. Prenatal tests are usually used in combination to increase their detection rate while maintaining a low false positive rate. Ultrasound imaging can be used to screen for Down syndrome as well. A 2001 observational study suggested that there is an increased rate of absence of nasal bone in fetuses with Down syndrome. Screening tests estimate the risk of the baby having Down syndrome. Diagnostic tests tell whether the baby will actually have Down syndrome. In 2002, 91 to 93% of pregnancies in the United Kingdom and Europe with a diagnostic of Down syndrome were terminated. Diagnostic tests such as amniocentesis and CVS may be performed. These tests have a much lower false positive rate. However, they carry a slightly increased risk of miscarriage.
Families can cope with Down syndrome in many different ways. Find a group of trusted professionals. These professionals can help evaluate the resources in your area and help explain state and federal programs for children with disabilities. Families with Down syndrome children can also seek out other families who are dealing with the same issues. Most communities have support groups for parents with Down syndrome. You can also find internet support groups. Another thing to help families cope with Down syndrome is to not believe the misinformation. Some people believe that children with Down syndrome must be placed in segregated special education schools and that adults with Down syndrome usually live in institutions. This is not true. Many people with Down syndrome live with their families or independently, go to mainstream schools, read and write, and have jobs. People with Down syndrome can live fully fulfilling lives. The most important thing to know about individuals with Down syndrome is that they are more like others than they are different.
My name is Chris Burke, and I work at the National Down Syndrome Society, and I am the Goodwill Ambassador, and I go around doing my public speaking and try to promote awareness of people with Down syndrome, and which is really important because October is the Down syndrome Awareness Month, which is very important to us because they try to spread awareness of people like us with Down syndrome, because it's not about our disability awareness, it's about our ability awareness that we're trying to come across. I'm hoping to see other people with Down syndrome just to do everything what they really wanted to do. It's about their passion, it's about what they're really good at. I want them to have the same abilities, like if I can do it, so can they, because public speaking is very important too, because of there are other people who are truly inspirations, who that we can look up to with a lot of admiration, which is really important things in life, And I have a very important motto, which I have as a picture frame, in my room, here in New York City. It says, "Obstacles are what you see when you take your eyes off the goal. Never let your eyes off the goals and make your dreams come true," which is very important. Is to always believe in yourselves, work hard, and to never give up. In the future, I'm still working for the NDSS, for the National Down Syndrome Society. I still want to stay involved with show business because that's my passion and that's what I'm really good at. And I'm very proud of that experience. And it gives me a chance to do other things besides acting. Who knows what's going to happen. Thank you, Riku Cinemas, for giving us the opportunities to do something like this, and it gives us a chance to be out there, in the theaters that needs to be shown people with disabilities and to think about our abilities.